Hi students, this is Dr. Badrinath. Today's topic is local anesthetic, short name called as a LAS, L-A, okay, local anesthetics, okay. So whenever you will approach a dental surgeon or eye surgeon for cataract surgery, small minor surgeries, local anesthetics are compulsory. See, name itself indicates local. It produces a locally. What it produces? Numbness, anesthetic. So this area, entire this area will become a anesthetic. This area, only local area. That's it. That's why it is called a local anesthetic. Temporarily, for a certain period, like a 1 hour or 2 hour, you will lose the sensation here. You will lose the sensation, but total body consciousness will be there. You can open your eyes and you can go there, you can walk, whatever it may be, you can do. But only that area, wherever they are giving an injection, that area only you will lose the sensation, but consciousness will be there. Your brain will work, you can talk with any others, everything will be there. Okay, so local anesthetics are compulsory for minor surgeries. It loses its sensation. You can lose a sensation here. The doctor will give a injection, local anesthetic. This is called a local anesthetic injection. So all the nerves which are present here, nerves, mainly nerves only carries the sensation, that we know very well. Okay, nerves are responsible for the sensation. So here all the nerves will be blocked here. Peripherally, the nerves whatever present in this region will be completely blocked. So you will lose sensation. Even though you touch there, exactly, you can't feel the sensation. Okay. So the doctor will extract the teeth, or he will do root canal surgery, whatever it may be, he will do. Okay. After 1 hour, 2 hour, it will go. Okay. That is called as a local anesthetics. So we are studying a subject of pharmacology 1. Okay. Here you can see your subject along with the course code, whatever it may be. It is important for all MBBS, nursing, pharmacy, for everybody. And also this topic here, you can see this is your syllabus, and here the highlighted point, local anesthetic agents. Okay, that is a today's topic, local anesthetic agents or local anesthetic drugs. Keep in your mind, there are in your syllabus, they have mentioned two, local anesthetic as well as a general anesthetic also. Okay, this is very important to know what is a local anesthetic and what is a general anesthetic. See here, this is a general anesthetic. See, general anesthetic, for major operations they will use. That point you have to keep in mind. For example, heart transplantation, kidney transplantation, open by heart surgery, or pancreatectomy, liver operations. In such a cases of very big operations called as a major operations, okay, general anesthetics are used. Very important bit. Local anesthetics are used for the minor surgeries only, like a teeth, eye surgery, okay, like a small, just a half an hour procedure, like that only. Okay, see here, this since both are mentioned in your syllabus, you have to see what is the difference between the both are, because most of the students are confusing here. See here, this is called a general anesthetic because total body will be in the you will lose the consciousness, complete consciousness. There is no sensation, there is no consciousness. See, site of action. So general anesthetics will act on the central nervous system, whereas a local anesthetic exactly acts on the side peripheral nerves, like a side. Peripheral means we know it is a side by side nerves. Okay, and area of the body involved is a whole body will be numbness. You will lose consciousness. You can't talk also. You can't open your eyes. You can't talk. You can't see any others, like the whole total body is involved here. Here only restricted area, only small area will be restricted. Okay, and consciousness you will lost here. See here, consciousness here unaltered. Consciousness will be there here. No change in the consciousness. Okay, only those area only you will lose the sensation. Okay, this is very important, consciousness, because most of the students they are confusing the words between consciousness and sensation. Okay, so care of the vital organ, vital functions is essential here. They can take, usually not needed, need not to be take any care because it is a local anesthetic only that. And physiological trespass is a high, and here it is a low, and poor of the health patient, it is a risky. General anesthetics are risky actually, that's why they need one anesthetic doctor, specialist doctor, MD in anesthesia, special course they have to do. They have to come for every operation, major operation, they have to give the injection to your backbone or to the below the brain, like that they will give the injection. Okay, not. But however, these injections the dentist will do, or ophthalmologist directly they can give the anesthesia. Need not to any specialist, or need not. Very very important bit. Okay. And use a non-cooperative here possible. Here it is a not possible. Cooperation, patient cooperation. Okay. And major surgery preferred. These are the preferred in the major surgery. Minor surgery, these are the preferred. Like that, you can be remember the local anesthetic versus general anesthetics. Yeah, here you can see the definition, see the injection, how they are giving further anesthetic. Directly they will give an injection to the here up and down, or wherever the which nerve they want to block. The depending upon that nerve they will block. Okay. Definition: local anesthetics are the drugs. These are the drugs which upon the topical application, you can apply the topically or local injection also. So generally they are giving an injection, but ointments are also available. If you apply the local anesthetic ointment here, this area you can lose the sensation. Okay, like that. So either it is available in the form of a topical application or local application, and causes the reversible loss of the sensory. That point is very very important. Reversible loss, not permanent loss. See, permanent loss means this area permanently lose the sensation, means it is very big problem. So reversible. Again, after 1 hour, 2 hours, the sensation will be back. Your sensation will be back again. Okay, need not to be that area. Perception, especially of the pain in the restricted area of the body. Yeah, local anesthetics having a common structure. Number of times, more than 50,000 times it was appeared in all the competitive examinations, like a NIPER, GPAT, or whatever it may be. So this is the general structure of all local anesthetics are having the same structure. See, this is a chemistry, local anesthetics, basic common structure. What it consists of here, it consists of a aromatic ring, like a benzene ring. We know that it is aromatic. Aroma means a smell. Aromatic ring. Okay, it is a lipophilic in nature. Very very important. Lipophilic, aromatic, lipophilic. It loves the lipid. Whereas here this end is one end is a hydrophilic in nature. Okay, so it is having a local anesthetic having a both property, lipophilic properties as well as the hydrophilic property. So amino groups are having a hydrophilic property. This number of times these questions was appeared. Later your wish. So at one end it is having a aromacity, lipophilic only, and here amino group, here aroma, here amine. See the name aroma amine, aroma amine, and this is a hydrophilic in nature. Here you can see the H, so easily you can remember NH amino group, hydrophilic in nature. Like that, simply you can have a trick. Okay, and hydrophilic, this hydrophilic and lipophilic are, see here, bridge is there. It is called as an intermediate. So total this structure is called as a local anesthetic. So 3 parts. Okay, this is a lipophilic part, hydrophilic part, intermediate chain. This chain is having only 2 links. Either a ester linkage, see COO, we know that, amethycoine, okay, cocaine, okay, amethocaine, and amide. Either it is a amide linkage. See, NHCO is a amide linkage. So this intermediate chain who having a possibilities of only 2 linkages, either ester linkage or amide linkage. These are the, that's why it is called a lignocaine. Okay, bupivacaine. Okay, and ropivacaine. Like all these are the prilocaine. All these are the amide linkage. Very very important bit. Okay, in the examination compulsory there will be a question which find the local anesthetic having a amide link, or find the local anesthetic from the following having a ester link. Like that it comes. See here I have shown the example. RCOR. It is a ester linkage. This is the example. You can see the example here. This is a common. This is also common. Aromatic portion, amine portion. This is a hydrophilic portion. These are all common. COOR is a ester linkage. Procaine is the example. See here, this structure. And here, this is a amide linkage. See here, amide linkage. Lidocaine is an example. This is very, very important in chemistry as well as in the pharmacology also. Classification, if you see here, the main important word is coin. Caine, it comes. COIN is a coin, but here you will get a cane. Like that you can remember. See, injectables, surface anesthetics. Surface anesthetics means you can apply on the surface. Okay, topical application. Whereas injectables, injection, 2 types. So injectables, if you see low potency, less potency, less anesthetic property. Short duration, only for 10 minutes or 20 minutes. Like example, very, very important. All these are very, very important in the classification. Low potency, short duration, like a procaine, chloroprocaine. Intermediate potency and duration, like lignocaine, intermediate, okay, and prilocaine, okay, and a high potency, long duration, 2 hours, 3 hours it will be there. The loss of sensation will be for 2 hours, so doctors will do easily 2 hours. They will take their own time and they can do surgery. Like a tetracaine, all these are the you have to keep in your mind. See here, procaine name, see here, procaine, here chloro, okay, procaine, both are low potency only, like that. And here tetracaine, dibucaine, see di means 2, tetra means 4, like that. Here you can remember high potency, long duration. Bupivacaine, ropivacaine, okay, you have to practice several times. Lignocaine, prilocaine, all these are the injectables only. And if you come to the surface anesthetic, soluble is there, insoluble is there. Soluble in water, all these are the soluble. These also appeared number of times. Soluble surface anesthetic, these are the cocaine, lignocaine. See here, lignocaine here also came, here also came. So lignocaine is available in the surface, that is a topical gel. Also, it is also available in the form of the injection. Tetracaine, see here, tetracaine injection is available. Tetracaine local anesthetic also available. Benoximate, like that. All these you have to practice. In the exam, they will ask you find the local anesthetic which is available in both forms, injection form as well as a that is a gel form or ointment form or topical form. Insoluble, like a benzocaine. See here, benzocaine, butambin, oxethazaine. Okay, all these you have to be practiced well for your easy remembrance. I have here shown the some of the Procaine. See here, Procaine. By seeing this image, very powerful images, you can keep in your mind for easy remembering. Cane. Here you can see Chloroprocaine. So Procaine, I have already told it is a short duration only. Short duration. Injections are available, I have told. So this is an injection. See, this is also injection only. Nerve block. It now injection only. Vial is available. See here, this is a Nesacaine. It is available. Nesacaine. Chloroprocaine. See here, this is available in the form of 1% solution. Like that you can remember. And I have told that lignocaine is available in 2 forms. So this is a lignocaine hydrochloride gel. So instead of giving an injection there, you can apply the ointment so that that area will be numbness. Lignocaine hydrochloride injection. It is a topical application. Here also you can see this is a tetracaine injection. Tetracaine. See here, you can see here. See the pointer, tetracaine amitab. Okay, gel, topical application, gel, like that. Okay, tetracaine. And local anesthetic, main mechanism of action is blocking of the nerve is the main thing. See, this is a nerve axon. We know that nerve is nerve ending, nerve axon. So what happened whenever these are the sodium channels. So nerve is consist of a sodium channels that we know, so that sodium will be entered into for action. For depolarization or to carry the signals, sodium is compulsory. Sodium has to be entered into the nerve, that we know very well. Okay, so what happened here? See this point. Unionized, whenever you are giving a local anesthetic, all are unionized only. But once they entered here, once they enter into the neuron, local anesthetic becomes ionized. Very important. So unionized anesthetic you are giving, it enters into the neuron, it becomes a ionized and it blocks the channel function. So sodium is important here. Sodium channel is blocked. So there is no entry of the sodium. So whenever there is no entry, there is no repolarization, depolarization and all. So signals will be completely blocked because you have blocked the sodium. Okay, that point. See here, the same point only here I have mentioned. Local anesthetics. It diffuses through the cell membrane. It binds to the voltage gated sodium channel. It blocks the sodium entry into the cell. So it raises the threshold for the excitation. Okay, and so no generation and no conduction of the action potential. So it produces a local anesthetic. This is a general formula, very important and neatly I have mentioned. And why? See, there was one problem with the local anesthetic. Local anesthetic, it causes the vasodilation. That is a main problem. Keep in your mind. Dilation of the blood vessels. For example, the doctor has given injection here. The blood vessels So actually it blocks the nerve sensation, but apart from the nerve, it also acts on the blood vessels here, which are present here. That blood vessels will be dilated. That is the main problem with the local anesthetic. So what happened? It do like this dilation. This is a normal blood vessel, vasoconstriction. Constriction. This is vasodilation. So this is the main problem is it causes a vasodilation. So whenever there was a vasodilation, what happened? Blood supply will be more. So what happened when there was a blood supply is more to this area, cheek area, more amount of this local anesthetic will be entered into the blood. So here the concentration of the local anesthetic here it will be less, because most of the local anesthetic whatever you have given carried by the blood because of the dilation of the blood vessel. More blood will come and it takes the more local anesthetic there and it go. So it causes a systemic toxicity. Systemic toxicity of the local anesthetic. Just imagine. That is the main problem. So LAS causes the vasodilation, very important. And it leads to rapid diffusion of the local anesthetic away from the site of the given. Here I have given that. From the site, what happened? Blood will be taken away, the local anesthetic. It results in the short duration of action. So very less time only it shows the anesthetic effect. It results in the quick loss of the consciousness at the area. Sensation actually here. You have to write as a sensation, not consciousness. Sensation at the given site. Okay, so if vasoconstrictors are used, so what we have to do to overcome this problem? Vasoconstrictor we are giving. That's why most of the local anesthetic always we are giving a vasoconstriction. Why means local anesthetic is having a vasodilation action. Due to that, there was a problem charge. So whenever you are giving a vasoconstriction, especially epinephrine, widely giving epinephrine, that point you have to keep. Most of the number of times it was appeared in the examination. Epinephrine vasoconstriction widely used for almost all local anesthetic. It is a combination. It is a vasoconstrictor. Why we are giving a vasoconstrictor? That was also biggest question in the exams. If a vasoconstrictor used, there was a two uses. No quick diffusion of a local anesthetic. So it will be there only. It will be there for a longer time. So increased duration of action, increased duration of the loss of sensation here, and reduces the systemic toxicity. That is also important. So it cannot enter because vasoconstriction is there. So local anesthetic will not enter into the body. So it doesn't show the any action, like very, very important bits. Yeah, here you can see some of the adverse effects, unwanted effects. These are the free gifts, compulsory from allopathy. Most of the allopathic agents having a side effect that you open fact that you know, I know, everybody know. Here also there, it depresses the CNS. Here you have given the injection, but what happened? Local anesthetic will enter into the blood. That it goes to the brain also, isn't it? So few amount will go. It causes a all local anesthetics are capable of producing a sequence of first stimulation of the brain immediately. Stimulation of brain for a little time, just for a 1 minute or 2 minutes, followed by depression. This is a main effect is the depression only. See here how the dull is brain. Whenever you have taken, your brain will become a dull. Initially, it will be for 1 minute quick. There is a will be there activation will be there. It inhibits the inhibitory. Why means mechanism of action? It inhibits the inhibitory neuron. Okay, neurons that results in the depression. Okay, on cardiovascular system, this is a cardiovascular, this is also dull. Okay, as usual does at usual doses no effect, but at high doses causes slight depression of the heart. Okay, decreased atomicity. The heart is having an atomicity. Automatically it shows the excitability, atomicity, contractility, conductivity, prolonged, and all these will be decreased. Prolonged ERP, effective refractory period. This is also very important. All local anesthetic enhances the ERP, effective refractory period. At toxic doses, there is a collapse, complete collapse of the heart failure may also be happen if you are giving a toxic doses of local anesthetic. Okay, on blood vessels that we know very well, it blocks the sympathetic system. So dilation of the blood vessels, parasympathetic system action it is having here, and decreases the blood pressure. So automatic what happen when the dilation of the blood vessel, BP will be reduced. Okay, like that. Here you can see some of the duration of action. See here, nerve block will be here 30 to 60 second Procaine, Lidocaine. Here you can see dibucaine. 600 minutes it shows, nearly 10 hours. This area will be blocked. Dibucaine means. This area will be loses a sensation for 10 hours, like a tetracaine, bupivacaine, and here onset of action also here it is a quickly you will lose the sensation here. It is a slow, it is a fast, it is a slow, it is a intermediate, and it is a slow, but it is a longer, okay, duration of the blockage of the nerve. Yeah, this also appeared number of times. LAs, that is local anesthetic formulations available in dosage form. In the exam they will ask you find out the local anesthetic which is available in both forms. So here benzocaine, ointments, creams, sprays, patches. Bupivacaine, extradural injection. These two are the mainly injection. Bupivacaine injection. Here also epidural, dermal injection, epidural injection. This is also available in the gels. Lidocaine. That point you can remember. So I will stop my session here. Keep watching in my playlist, channel playlist. There I have uploaded all the subjects.